I'll be your host today. I'm joined by Dr. Ashley Ritter, the Chief Executive Officer, and she'll be sharing a New Year's message, and then we'll be answering a few of your questions. Ashley is a nurse practitioner and completed a PhD and postdoctoral training in health policy research. She is the Director of Research at New Cortland, a Philadelphia nonprofit that increases access to housing, health, and social services.
Thrilled to join everybody today. Hello.
So as a reminder, we don't take questions cold, so we'll be pulling our questions from prior submissions to the Nerdy Girls question box, and you can always submit one on our website at dearpandemic.org. So I'll hand it over to you, Ashley, so you can give an update on what to expect from those Nerdy Girls in 2023.
Thank you. I'm very grateful to the Nerdy Girl team and for the people to continue to engage with our content. I wish we could stop talking about COVID, but we can't. COVID-19 continues to cause disruptions in day-to-day life with surges of infection and serious consequences affecting people everywhere. So those Nerdy Girls will keep providing up-to-date, factual, and practical health information about COVID. You know, in many ways, this work has become more difficult over time as there's been decreased systematic support for consistent guidelines to inform everyday actions like sending kids to school and entering public settings. Those Nerdy Girls will continue to provide guidance based on evidence and delivered with empathy. I shared one of our posts recently to help my brother get COVID-19 rapid tests. He didn't know he could use his health insurance to cover the cost of the tests. The information he needed was already packaged by the Nerdy Girls team, and I could easily share that information with somebody I care about. And I hope that you can do the same with the people you care about. In addition to the COVID-19 content that we've provided for almost 3 years now, we continue to provide expert content on mental health, reproductive health, misinformation, other infectious diseases, and on other pressing public health topics. Our goal is to engage you. And if there's a pressing public health question that you need some trusted and practical advice for, please hit up our question box.
Well, thank you very much. Shall we tackle some questions? Okay,
Sounds good to me.
Why don't we start with the new variant, the Kraken variant? So, and maybe just a general question about how do new variants impact our thinking about boosters and precautions and level of concern?
That's a great question. So the XBB 1.5 is a COVID-19 variant from the Omicron lineage. Again, we've had multiple variants over time. This specific variant has two advantages over other variants. So the first advantage of XBB 1.5 is that it's able to sneak around the immunity of people who already have antibodies, whether that came from infection or vaccination. And it does so better than other variants, which enables it to cause infections. The second sort of competitive benefit of this new variant is that it's able to bind more easily to the ACE receptor. And that's the binding that allows the virus to enter your cells and to replicate, and thereby making you sick. So we have evidence that there's more of this variant circulating, and it's sort of crowding out other variants, and that's why we're seeing more of it. So to date, we don't have evidence that XBB 1.5 is more dangerous, but we do have evidence that our bivalent booster decreases the risk of infection with this new variant. So this is great news. Unfortunately, only about 15% of Americans have received their bivalent booster. And so it's really important that we encourage people to receive this protection, as with an Omicron or you're less likely to be infected as compared to somebody who only has the original vaccinations on board. Mm-hmm. We're going to continue to see variants come and go, but at this moment in time, the bivalent booster is still worth it, and I encourage people to get it. And really remaining up to date on COVID-19 vaccinations and other preventative vaccinations can help to prevent infection and those serious consequences. This is particularly true for people over the age of 65 who are at the highest risk of those severe complications. Mm-hmm. So I encourage each of you to have some kind and informed conversations with the people you care about to remove these barriers to getting up to date on your vaccinations. And, life is busy and lots of people have very valid questions about this evolving pandemic. I think conversation is one of the greatest tools we have to share good information, normalize this evolving nature of science, and to encourage behaviors that really do save lives.
Thank you. I think one of the messages that I like to reinforce is that don't let perfect be the enemy of good. So,
Exactly.
in theory, there could be a better booster or a better rapid test, but the ones that we have are still pretty darn good.
Exactly. And, things get busy. It's not too late to get boosted with a bivalent booster. It's still helpful to you and still worthwhile. Well, I have a question for you now, Chana.
Great.
So rapid tests continue to be one of the tools. Are the rapid tests still useful for detecting COVID-19? I've heard lots of stories about people who probably had COVID yet had multiple negative tests. Can you tell us more about that?
Yeah, I think well, the bottom line is they do still work, but their performance is a little bit impaired, slightly weaker. The actual impact on performance is going to depend on the brand and the variant. So it's hard to put a single number on that, on how much it's been impacted. But the FDA did review performance a while back, and there were no tests that they said we shouldn't be using them anymore. Actually, I believe there was one. They flagged maybe one brand, and then that brand went and back and did some work on it. So it is something that's being continually looked at. But I think it's extra important right now because performance has slipped a little bit to be aware of the limitations of rapid tests and to know that a single negative test is not a green light, to go back to normal life. So just to give you, I was looking at some data recently, and just to kind of give you a sense of this, there was a study on early Omicron variants. They looked at BA1, BA2, and BA5, and they test two different brands. They found that in the samples that had really high viral load, so samples that were collected just at the right time when the virus was really high, both tests detected about 90% of the samples. But in the tests that had lower amounts of virus, and maybe those were the very early samples, for example, where it's a little bit trickier to pick it up, the Roche test seemed to drop a little bit with the variant. So with the BA1, it dropped by 4%. With the BA2, it dropped by 20%. And with the BA5, it dropped by 10%. So that gives you a sense of yes, it's not picking up 90% anymore. It's picking up 70 or 80 or something like that. But it depends on whether it's a low virus sample or a high virus sample. And whereas the other brand, in this study, we looked at the Acon Flowflex, it actually wasn't impacted by the variant. So this is why it's a tricky question to answer, because the answer is always going to change depending on the variant. And so you can't say this brand is always the best, choose this brand, because each brand uses a unique antibody to detect that target. And as the target changes, it's just sort of a bit of a matter of luck of which one is hitting the part of the virus that didn't change very much. So we don't have published data on the Kraken variant yet, but we expect it'll be similar to some of the other Omicron variants, where some brands took a pretty substantial hit, especially in the early days when the sample and the virus levels are low, but they all tend to work quite well once the virus level hits a high enough, once the virus levels get high enough. And that depends on the person. Sometimes that will happen on the same day as symptoms. Sometimes that will be 3 days or more after symptom onset. I think people are often surprised to learn that your viral levels can be higher as you're starting to feel better sometimes. So they tend to peak actually more a couple days after the symptoms start, which is when you might be feeling a bit better. So we actually did a little poll. I did one on my page and on the Dear Pandemic page, and we found that 50% of people, so we polled people who had COVID in the last month, and we found that 50% of them got their first positive test in day 0 or 1. And then 30% of people, it was day 3 or later. So it's quite a spread. And you might hear more of the negative stories because someone is there's a bit of this sort of bias in who tells their stories. And so often you hear about the person who was positive for a week and never tested, but there's actually a lot of people who are getting great results. In my family, we've had rapid tests work for us beautifully. 4 different times we've had COVID, and whoever had it first caught it early, and 3 times out of 4, nobody else got it. So they are doing a lot of good out there. And so they get a bit of a bad rap because they're not perfect. But again, perfect is the enemy of good sometimes.
Yeah, no, I agree with you. I think that there's still a lot of value in testing. They're not perfect, but they're absolutely something that can be useful to us to give us real-time information. So you talked a little bit about when you might test positive or not. What do we know about the contagious period of COVID-19?
Yeah, that is also still, sorry, before I answer that, let me just mention I forgot to drop in some links that I wanted to share. So I have a link I just posted for an article that you, actually, I think it was Jen that wrote about the XBB
Yes, it was Jen.
variant. And then I'm also going to drop in a link for a post that I just wrote on new variants and rapid testing. It went out today, and then we'll move on to the next topic. Sorry about that. So contagious period. It is still not absolutely nailed down. We do know that the vast majority of spread happens in the first 5 days. And things get fuzzy after that. And I think there's probably a lot of variation from person to person. And so, the guidance to isolate for 5 days and wear masks till day 10 makes good sense because we know you're contagious in the first 5 days and you might be contagious after that. We can't say for sure. So that's why I think rapid tests are actually useful, and not just me, but many people have used rapid testing as a guide of how much virus are you still carrying, and that especially if you have a strong signal still in that, beyond the 5 day period, it's really a sign to be extra cautious. I mean, you want to have some level of caution anyways, just because of that generic possibility, regardless of your symptoms, that you could still be contagious. But the rapid test can be a useful second layer of information on top of that.
That's excellent.
So what is your advice, Ashley, on masking these days? There are a lot of questions in our question box about, when should we mask? How much value does it still add, in travel, in schools and gyms? And so how do you think about that?
Well, as you said before, let's not let perfect be the enemy of the good. So I think that masks are a valuable tool, especially during respiratory illness season, which we continue to be in. But to be successful in using a mask when it helps most, it's important to keep masks around, and specifically high quality masks. If you're still using cloth masks, now's a really good time to switch to a KN95 or an N95. And the reason is those better quality masks are able to drop some of those smaller particles that might hang out in the air and can still infect you. And the other sort of tip to be successful in masking is that there's going to be times when we want to flex up in our mask wearing when risks are higher, and then there's going to be times where infection risks are lower, and so it's not necessarily an all or nothing situation. And the other is that masks work, and so do those other mitigation practices that we used more frequently earlier in the pandemic. And so these are all strategies that we can use to decrease the risk of infection. So I continue to wear a mask in some situations to decrease sort of like the overall risk to my family and my daily contacts. So I really don't like having to cancel plans, and I absolutely despise having to make that dreaded phone call that I just tested positive and we spent time together yesterday. So I do my best to mask when the risk of infection is pretty high and the reward of taking off my mask is pretty low. And so I'll give a couple examples of when I think it's pretty easy to use a mask and how I make it work. So for example, I always mask at work. Sometimes I am the only person in a mask, and that can feel weird when it first happens, but I've persisted, and it's pretty normal that I have a mask on, and sometimes it even causes others to put a mask on. Mm-hmm. I have high-risk colleagues and patients that I take care of. I also have extremely high-risk parents, and I also have exposure to tons of germs because I have 3 children who are of school age. So I'm trying to do my best to keep everybody healthy, to not share germs outside of overlapping networks. And masking really doesn't affect my job in any way. So I saw some of this flexing up and down the week after the holiday break. Many of my colleagues at work were wearing masks. because there was lots of travel after the holidays, and everybody had experienced people in their networks that had experienced infection. And so, that was an example of a time you might consider flexing up after lots of travel, or when case rates are popping up pretty quickly. Because I always wear my mask at work, it's a habit, and it's pretty easy for me to just like go about my day without realizing my mask is on. Some other situations where I mask are at the food store, if I'm using any sort of public transportation or flying, going through crowded airports or crowded indoor places, I continue to wear a mask. And so this practice takes away some of the risk that my contacts pose to me and that I pose to others, without really interrupting my day at all. I don't mask in small social gatherings. That doesn't mean that the risk has gone away, but I choose not to mask in some gatherings that we might have at my house with family friends. And for me, the benefit of good food and company are super important, and I need those social interactions to sort of fuel my soul. When I'm going to practice, to engage in something where it will be very difficult to have masking, I try to use those other mitigation measures, such as rapid testing before we get together, maximizing the air filtration and the airflow by opening some windows. And if somebody in the house is feeling not well, we just cancel our plans and reschedule for later. So my hope is that we can look at risk mitigation measures like masking as a form of harm reduction. The masks are not going to stop every infection, but they certainly decrease COVID-19 transmission, as well as the transmission of other respiratory viruses. And there's multiple studies that show that. They remain a really important strategy to minimize infection and daily disruptions.
Yeah, I think it's great that you mentioned this is not just about COVID, right? This is about the respiratory illness season when people are dropping like flies.
It's brutal. We were hit early in the season in our household, but we had multiple weeks where somebody was sick, and that disruption, it's hard to say if we had worn a mask here or there, would it have happened? Who's to say? But if you can avoid a little bit of that, that's not a bad thing.
Yeah. I mean, I think that's one of the silver linings of the pandemic is the familiarity with the mask, and that it is a tool we can just put in our purse and whip out whenever.
Yes.
Yeah.
Yeah, it's definitely a practice that we'll all have to get used to. Teaching kids that, oh, you're returning from school after an illness, why don't you wear a mask for a few days? Or there's 6 kids in your class out this week, maybe we'll wear masks again. And even sort of socializing adults too. This is something we use sometimes, and that's for our own protection and not a punishment.
Absolutely.
So I have one more question for you, Chana. Do you have any advice for navigating the flu? Another of those respiratory illnesses floating around.
Yeah, absolutely. I think we need to have more education around flu because it is so much a part of our lives right now. There are 2 parts to this. One is taking care of yourself, and the other is preventing spread to others. So in terms of taking care of yourself, honestly, the most important things are rest and plenty of fluids. You could also take pain relievers to be more comfortable. But if there are some people where this is not going to be enough, and so you need to know which camp you're in. And if you have a really severe infection, or you are someone who's at higher risk of complications, you really should be talking to a healthcare provider and getting some, potentially getting some antiviral medications is something to consider. There are several options out there. And these can even potentially shorten your illness by a day, and they can help mitigate the chances of serious complications. So I recommend, just being proactive about that. The earlier, the better. And I'll drop a link from the CDC about flu. And then in terms of looking out for others, it's kind of interesting now that we have, so many of us have thought in detail about COVID to be able to compare that to other respiratory illnesses. And I think the difference here is that with flu, it's actually a little bit more straightforward because the contagious period overlaps a little better with the symptom period. And so the guidelines say that you are likely most contagious for the first 3 to 5 days. And it is possible with the flu to infect someone before you feel sick, but it's much less common than it is with COVID. We see a lot of pre-symptomatic spread of COVID. We don't see as much of that with the flu. And likewise, after 5 days, it's quite rare with the flu. It can happen, but I think with COVID, we see more of that later spread as well. And then so, knowing this, just use your maximum precautions while you're feeling unwell. Try to stay in your bed, stay to yourself. I know your kids are probably going to want to snuggle you, but just keep in mind any close contact is a risk, really. And similar precautions can be effective in terms of masking, hand washing, ventilation. So, yeah, that's pretty much. Anything else to add to flu? Is this something?
No, I think that's great
Yeah.
advice. If you're not feeling well, I know there's pressure to keep going, and not have any disruption. But spending a few days keeping to yourself can really do so much good for not only your recovery, but not spreading infection to other people and adding to misery. So I think that advice is great, Chana.
Yeah, good. I'm just dropping the link to as we're going to be wrapping up in a moment, I'm going to drop in a couple of last links, and then I'll encourage you to submit more questions for our next live. We're trying to do this about once a month, and if we can sort out a time that works for everyone. So keep submitting your questions. We do read them all, and if we don't cover them in the lives, they do inform what we write about on our page, and we do post on Facebook daily, and our website is a great place to search our archives for all of our posts and to share them with others. So one last thing to mention is that we do have a newsletter, so I recommend signing up for the newsletter as well, which you can do on the Dear Pandemic website, and it'll show up in your inbox. How often is it now? Is it twice a week?
It's twice a week, and we had about 300 new subscriptions this week. So thank you to all of our subscribers. It goes to about 11,000 inboxes, and it's a nice way to get this information directly to your inbox, so you don't miss any posts on social media channels.
Right. And last but not least, just a disclaimer that you should always seek the advice of your healthcare provider with questions about your specific situation. We can only give very general advice. So that's it. That's all the time we have for today. So thanks for tuning in, and thanks for engaging with us and sharing with others.
Yes. Thanks, everybody.
Take care.